I'm not going to be working as many hours. And that was a little weird because I'm just like, if I'm not a veterinarian, who am I? Our identity's so wrapped up sometimes in that. So I was thinking about like, what will I do? And so that's where the no sweat vet came in.
Hello, Vetfolio voice listeners. Welcome back. This is a super cool episode featuring the no sweat vet herself, Dr. Karen Wheeler. And if you aren't familiar with the no sweat vet on social media, let me elaborate. For many pet owners, bringing a pet to the vet can be a bit nerve-wracking. It brings up a lot of questions that don't always offer easy answers. Is my pet okay? Have I been taking good enough care of them? Is whatever is going on my fault? Will it be expensive? What if it is and I can't afford it? So Dr. Wheeler knows all about these worries, and after decades in practice, she's seen how much uncertainty and anxiety pet owners can bring with them into the exam room. And so with that in mind, she set out to find a way to make veterinary care feel a little less intimidating, and she's found a new niche doing just that on social media. Known on Instagram as the No Sweat Vet, she's been creating short, easy to understand videos to break down topics that might otherwise feel overwhelming for pet owners. We had such a good time recording this episode and talking about her passion for education, how she's embraced social media as a tool for client communication, and how she's using her platform to help pet owners and her fellow veterinarians. Let me tell you a little bit about her, and let's talk about it. Dr. Karen Wheeler graduated from the University of Minnesota College of Vet Med in 1985 and has been a small animal practitioner in the Twin Cities for the past 4 decades. She's been published both nationally and internationally, including articles dealing with exam room strategies, workplace personalities, and inherent stress of being a busy practitioner and a quote-unquote doctor mom. Having once been accused of having a caffeine-secreting tumor by vet school classmates, she also loves to write, garden, hike, and spend time with family. She's currently working on a book, but it is just so hard for her to sit still. Now, as retirement loomed, she began to get nervous, and one of her favorite things in the clinic was connecting with owners and helping them have the best life with their pet. And how could she do that if she wasn't in the clinic as much? Then, one day, a client put a little bee in her bonnet, and she decided to start the No Sweat Vet Instagram account, which would give her the ability to continue to educate pet owners and help build and nurture the human-animal bond. But did she mention she knew nothing about Instagram and was about as tech-savvy as a pencil? Her words. So, again, her words, if this old boomer can connect with the pet owners on social media, listen to find out how you can do it too.
Are you passionate about animals and love helping people? In the fast-paced world of veterinary medicine, exceptional client communication is just as important as quality pet care. As a customer service representative, you're the heartbeat of the practice, the first and last person clients see. You provide comfort, support, and trust in every interaction. This course is designed just for you. It's interactive and practical, featuring real-world in-clinic video scenarios, engaging knowledge checks, and printable resources to give you the tools, confidence, and strategies to handle any challenge and elevate the client experience. Register today for the Certified Veterinary Client Service Representative course on vetfolio.com.
All right. Well, I'm excited to be joined by Dr. Karen Wheeler, the No Sweat Vet. If you haven't seen her on Instagram, I highly recommend following her account because, Karen, thank you so much for joining me. You just have so many good tidbits to share and are just so relatable in that way. So I'm really excited to get to talk to you a little bit more.
Thank you. Yes, I'm excited to just talk with you as well.
Yes. So we met at VMX 2025 just recently, and we were both in Dr. Tanasia Crocker's social media workshop. And you were talking about you were making these client education videos on Instagram and Just listening to your description of some of the things you were doing, I went, wow, she's way ahead of anything I know how to do. So I'd love to kind of dive into multiple aspects of that, certainly from the social media aspect, but also from the client education perspective. Can you tell us a little bit just about your background, how that influences your communication style and education style when it comes to talking to clients?
Yeah, yeah. So I knew I wanted to be a vet from the get-go. So when I was in sixth grade, I got a horse, and the vet came out to the horse barn. I'm like, that is the coolest job ever, and I want to do that. So I just never looked back. And so did that, and I was raised by mom who was a teacher, and then eventually went on to become a principal. So education was always, a big thing in our house. When we're young veterinarians, our focus is we're just learning. So we're trying to figure out what is this diagnosis and how do I treat it and how do I work this up and how do I manage this with the owner? And as we get older, I think we have more experience and now we go in and we're like, okay, this hyperthyroidism, I know, well, I don't need to go look anything up. I know all the spiel. And you can focus more on your interaction with clients. I love that education part is it just sort of frees you up a little bit more to do more of that because you don't need to put as much focus on the learning stuff, which everybody has to do at some point in our career. So,
That makes a lot of sense. And I certainly, I think I have experienced that really probably in the not too distant past in my career. I'm 11 years out now. And yes, there are certainly some things that feel just a little more natural to explain. It's a little easier, and pitfalls that I have encountered that I know to avoid. I was talking to a younger colleague not too long ago, and she was talking to me about how to communicate with a client about it was either Cushing's disease or diabetes, one of these chronic endocrinopathies that takes a lot of management, at least in the
mm-hmm,
beginning.
mm-hmm,
And I said, one thing I'll tell clients is, look, in the beginning, we may have to retest a bunch of times before we get it right. Some animals, they read the book and they get it right off the bat. And then other times we have to make a lot of adjustments. So it might get a little intensive in the beginning. Don't get mad at me. I'm telling you this now. Hear my
right.
voice now. And so she went with that same type of communication. And she said it really made a difference as they were going forward because this was one where they had to do a lot of retesting. And she said the client said, nope, you told me in the beginning. So you do, like you said, kind of the spiels, you get the hang of it a little bit. I'm curious when, we're talking about interviewing for vet school and things. And of course, there's the don't say you want to be a vet because you don't like people.
Right,
Because
right.
every
Totally.
cat comes attached to a human carrying the carrier, every dog comes
Exactly.
attached to a leash, horses, things like this too. Yet, communication can be something that's really, it doesn't always come naturally. And so I'm curious from your perspective throughout your career and working with other veterinarians, what do you feel like are maybe barriers to effective communication and things that maybe we can focus on to really lean into being a good communicator and expressing our thoughts, our ideas to clients effectively?
Yeah, great question. And yes, I've worked with many personalities and I think everybody gets their own style. Some things that I think a big barrier is we just have only so much time in the exam room with clients. So you're trying to get everything in. I think some veterinarians they're not intimidated by their clients, but they just want everything to be perfect. So if the client isn't exactly on track with them, that's upsetting to them or sometimes gets them off. A big thing is just get in and get some rapport with the client so they know you're on their side. We're both trying to help their pet the best we can. And I have a colleague who I don't know how she does this, but she comes flying out of one exam room, washes her hands, goes flying into another exam room, doesn't even look to see what she's going in with, just goes in. And I can't do that. But what I do is take about 30 to 45 seconds, even if I'm behind, and I'll look to see what's my next appointment. And then I will look in our computer system, I can look back to see if I've ever seen them before. And then I'll look back at my last exam notes and just see if I've made any tips about this owner. And kind of, as we all know, we can kind of do tips just like owner has a strong feelings about feeding a raw diet. Owner declines lab work, owners worried about anesthesia. It helps me know where this owner is. So I do that. I always make sure I double check the gender of the pet because there's nothing worse, as we all know, and I've done it and everybody's done it, where we go in and we start calling Dusty a girl and Dusty's a boy, and that right away puts us a little bit on the wrong foot. And then as soon as I get in the room, I try to find something that I have in common with that client. If I don't know them, because I also have a little place in our records where I can put their son played lacrosse with my son, or, somehow how I might have a connection with them. So I try to remember that. And right away, even though I don't know them or, we don't have much in common, I don't know. I just feel like I've kind of got this. This is one thing I can connect with you no matter where you're coming from. Other things, as far as the time part, over the years, it's varied and sometimes we're short staffed, sometimes we have more assistants and technicians available. But if I can, like when we're doing the exam, and then if we have to draw blood or do the nail trim or express anal glands or take x-rays, if possible, I have my assistant take the pet out, and then I've got 7 to 10 minutes, maybe, more or less, to talk to that client without any distractions. So even if we're going to draw some blood, but we haven't talked about what it's going to be, they can take the pet and then I can just start to explain, this is what we did. This is the blood work we did last year. This is why I think we should do blah, blah, blah. We can just talk about, okay, so this is this dermatitis that they have. This is what we could do. And so it just gives me time to talk with them. Some owners like to have everything done in the room, which is totally fine. But then it's a little harder to keep a flow of conversation going, I think, when I'm trying to do all these other things. So if they're okay with it, it really does help me to just have that time to communicate with them. I don't know if that makes sense, but
Yeah, I think it absolutely makes sense. And yeah, I do want to ask you a little bit more about that because I'm a house call veterinarian. And so everything is in front of the owner because
right, of
where would
course.
we go?
Yes, exactly.
Which, of course, that it does necessitate a certain type of client as well. There's some
Mhm.
pets and some clients who just, they're, house call isn't the best fit for them. I know I do a little bit of work in a hospital as well, and I try to talk to technicians about like, don't tell the client we're taking their pet in the back. Like the back conjures up all these like horrible images.
Totally.
We're always going to the treatment area, and I'm always reassuring clients, hey, if they don't do any better back here, we're going to bring them right back to you. And I tend to feel very, very strongly about doing as much as we can in front of the owner so they're involved. And I think some of that it comes from being a house call veterinarian.
Hmm.
So I'm really curious because I think you make a good point about it is distracting sometimes when the pet is there, even if it's not distracting for the client. I mean, if there's a cute little dog that's coming and giving me kisses, I'm for
Right.
sure distracted
Totally.
and having
Totally.
having a blast with this puppy. So how do you communicate with clients about taking their pet out of the exam room and kind of what's going to happen and keeping that comfort level and that level of trust?
Yeah, so that is a great question because it's changed a little bit over the years. A lot of times we'll do a lot of things in the room, and I try to be so upfront and with the owners. So if I'm like, we can totally express our anal glands in here, but it'll smell, and the rest of our appointment is going to smell. Are you okay if we take them back? So I usually kind of ask. I don't just say, oh, we're taking them in the back.
Sure.
We've had many conversations over the years about don't say in the back, take them
Right.
back to the treatment area. But I think you make a great point in that there is this connotation. What is in the back,
Right.
and what are we doing back there, and how are we torturing? And then, of course, the pet cries out when we do the express anal glands. I just had that happen yesterday,
Oh
and
no.
I'm just like, oh, he has strong opinions about having his anal glands, expressed. These are their babies, and so it's kind of you do have to read the room. You have to read your client and make sure that they're okay with it. And there's sometimes where I will just do it in the room, but if they have to take x-rays or something, if I don't have to go help hold, that's a good time for me to be in the room. And that's when the client can't go back. But I mean, it's a great point because you definitely have to know where your client's at that. And I'm very direct typically with clients. So I'll just say, are you okay with that? Because if you're not, we can totally do it all here. But otherwise, they can take them back, and then I can talk to you about this stuff a little faster, and most of the time they're like, oh yeah, that's fine. So
Yeah, it sounds like just very direct and straightforward communication to say and softening the blows a little bit because it's anal glands are a great example. We can't explain to this pet like, hey, we need to express your anal glands, and of course they're not going to be happy about it, and so it wouldn't be unusual at all to cry out for something like that. So yes, to say, oh yes, strong opinions, and that's totally fair. I think most of us would agree with
right,
those opinions, and
exactly,
uh,
exactly.
I when I do work in the hospital, the walls are very thin, and so I when I'm excited and I'm, oh, good boy, good boy, good boy, and getting
Hmm.
really excited, I try to not really hold back in terms of volume there, because I'm going, if you're going to hear one, that is the majority of the sounds coming from the treatment area,
Exactly.
is, we are
Exactly.
excited to see our patients and we're having a good time and the
Totally.
dogs and cats are doing great. But if you're going to hear something coming from the treatment area, that's what I want you to hear.
Exactly. Yes. And or if like, well, I guess just to that point too, I try to be here again because sometimes you've got a pet recovering that's yowling or they'll hear a noise. And so I'll say, "Oh, he's still seeing some pink elephants
I
after
say
his
the same
surgery."
thing.
Yeah. And
Oh,
so
I'm so glad someone else says
yeah,
that. Yes, the
it's
pink
yes,
elephants.
and so I try to explain the weird if there is a weird noise, kind of not necessarily make light of it, but try to acknowledge it, but also say, "Hey, nothing's horribly wrong. It's just
Right.
these are some normal noises that can happen." So
Yes, one of my favorites is, oh, someone is back there getting a nail trim and is sure we're going to amputate that foot. Like that whole
totally,
foot's coming
yep,
off.
yeah. So those are perfect things for kind of helps owners put it in perspective. Or I sometimes, if I get a really dramatic dog, I'll just say, if my daughter was a dog, she would have been this dog
I
because I
love
had
that.
very dramatic daughters. So yeah, so.
Oh, that's perfect. That's perfect. I think those came out as like these great communication tips that were just so organic, and this is where I think you're finding a lot of success with some of the videos that you're doing, because in talking to you, you come across as just so genuine, so happy, so there to for the good of the pet and the good of the human. And it sounds like that really is coming across in both your in-person communication and certainly in your videos as well. So I want to pivot a little bit here for a minute and talk about the videos that you make on, is it Instagram specifically? Do you
It
have them on
well,
other platforms?
I've done just a little bit on Facebook. So I'm like 64 and I've kind of cut my hours back a little bit, both to manage some chronic medical things. Last year, my dad was still alive. He was 92 and he was an hour and a half away. So I was often going down to help him and things. And so I didn't want to increase how many hours I was working, but we needed more people in. There was a doctor that had left. And so they were going to hire a full-time doctor. And then that doctor would absorb the hours I was currently working and I would just start doing like maybe some relief for vacations and sick time. And that was a little weird because I'm just like, if I'm not a veterinarian, who am I? Our identity's so wrapped up sometimes in that. So I was thinking about like, what will I do? And I just can't stop being a veterinarian. And I love working with the clients. And so I had a client come in last May and we were chatting and then he asked if he needed preventives. He said, no, I don't need any. I've got them. I get them free from my job. And I'm like, cool. What do you do? And he said, I work for a veterinary company and I do their social media. So we started just chatting about social media and he goes, oh, anybody could do it. You just put your lab coat on, put a stethoscope around your neck, hold your dog, and just then anybody can do that. And so I asked him a few more questions, but then I'm driving home that day. I'm like, was that you, God? Is that what I'm supposed to do as my next step? So I that got that bee in my bonnet and I started thinking about it. But the problem is I know nothing. So I went home and I just started, well, on my drives to Rochester, I would brainstorm, well, if I did videos on talking to clients, what would I do? And then also thinking up a name and all these things. So, what I learned from all of this stuff that I was doing is that, first of all, you need to think of what's my niche. And so, in my case, my niche was going to be talking to the regular Joe pet owner. And what helps me, either when I'm doing any writing or if I'm doing this sort of thing, I just have a few people in mind that I'm talking to. So it helps me just sort of talk in a regular way because another thing came up as I was talking to my kids about doing this. I have three very intelligent professional kids, and they're like, "Well, we would be nervous going to the vet." Of course, they don't have to go to the vet because their mom's a vet, but or at least they don't usually have to go to. But they said we would be nervous, a little bit nervous and anxious going into the vet. I'm like, "You're kidding me? Why?" And so I started thinking, gosh, if they would be a little nervous or anxious going in to talk to their vet, other people must. And so that's where the no sweat vet came in. I just thought I want to make this like it's no sweat, you guys. We're just people. We're here to help you. And then you want to do one of three things when you're doing social media. You want to educate, you want to entertain, or you want to inspire. And so I thought, okay, so mostly I'm doing this to educate because I just want to help pet owners. And then I thought, okay, now I need to figure out how to post on Instagram because this is terrible. I didn't even know how to do a post on Instagram. So I Google how to post on Instagram, what's coming up with how to edit and how to do it. And I'm like, no, no, no. I don't even know what button to push to start a post. And so I had to like Instagram for dummies. And I finally found, and my kids kind of showed me a little bit. So I had to go from the very beginning. But YouTube videos are wonderful. So I just watched a lot of them. But I do think, okay, I'm going to do everything I can to try to make these as easy to watch and as interesting to people as I can. So, so then you edit. So my kids helped me a little bit for my birthday, and then for Christmas they had gotten me little things. It was such a learning curve, but there's so much out there. And I always say, if I can learn it, if I can do it, anybody can do it because I am not tech savvy. I mean, I'm not stupid, but that's just not my forte. So, but with learning, I mean, so many times I'd have my computer up trying to practice something and my iPad next to me on the YouTube channel, and then I'd stop it and back it up and I'd be like, okay, okay. And eventually you just kind of figure it out. So,
I'm in the same boat as you. I'm still working my way that direction and learning because there is so much to it. Yes, Dr. Crocker, who hosted our social media workshop at VMX, she is the one who, not this past year, but the year before, had to teach me how to make an Instagram post. I also had no
okay, yeah,
idea.
and she was awesome at BMX. She did a
Yes.
great job. And then video editing, it was a little bit like, ooh, boy, how do I've never edited a video. I don't, it just is, it's hard enough for me to just do the basic. I haven't like done a lot of things that like just the other day I wanted to focus in. I was doing a little one. I wanted to focus in on something I was doing, and it took me 2 hours of looking up videos. There was like several ways I could do it, and I'm like, oh my gosh. But now the next time I do it, it won't take me that long. So it's good to learn and to keep our brains going and to figure it out. But I think the big point is it's doable, it's manageable. And I think, like for many people, when I think about me, I'm doing it. I'm not trying to build a practice. I mean, retiring. I just want to help people. I love helping people. I love helping owners have a better relationship with their pet. I love all of that. And so that's my goal. But if somebody was like, hey, I have this practice, I want to grow it, try to aim it towards your community or to potential clients, or, you just sort of think of who am I trying to appeal to and why am I doing it? Because the other thing I found is like have your own voice. And don't worry if somebody else has already said it or somebody says it differently or you think somebody's saying it better because we are unique. We have our own voice, and there is somebody somewhere out there who's going to benefit from hearing our take on things. And my thing when I first started too is like, because you look at these big accounts and they're so good at it and they do all these cool effects. And I'm just like, whoa, okay, but I'm not going to compare myself to them. I have some knowledge just from being an old boomer vet. And so that was sort of like at first, I'm like, gosh, I've hardly got any followers. This is terrible. The only people following me are my family. And I'm like doing all this work and so much work at first because I didn't know how to do it. And then I'm like, I'm only getting it to like, 12 people. But then I thought, okay, if I'm in the exam room, I'm educating one or maybe two people in the exam room, and that's fulfilling to me. I've helped those people.
Sure.
To those people, I am the world. I've just taught them something. And so now maybe I'm not doing 12 people, maybe I'm doing 120 people, but I'm still, if I'm helping them, you just can't look at the numbers. Some of those people have amazing accounts. And you know what? That's awesome for them, but I just don't see that for me. I sometimes feel like I have to be a little more wow, and I'm not real wow, but
But it doesn't feel genuine. And if it
exactly.
doesn't feel genuine, it's that's going to come across in your communication there.
Yes, because to me, I just decided that just wasn't important. I'm helping
Yeah.
the people that are there in front of me, and I'm not going to worry about. how many there are. So
So many good points. So many good points. Like there that was just gold there. One, it felt very validating to know that it took a lot of time to learn this stuff because that's what I'm encountering too. And sometimes I mean, I'm not like a tech native. I'm an older millennial, but at the same time I still, I feel like sometimes there's this expectation on my generation that like we can just do this stuff and
I
I'm like I
know, give
have
it to a
no
young
idea.
person. Yeah.
Yes, like I don't follow that category anymore. So that's very validating. And yes, I love that, have your own voice and reach the people that you're trying to reach. I'm curious with some of the videos that you made, have you gotten direct feedback in the exam room of, "Hey, I saw your video and it made me feel better about this," or has it saved you time and appointments because you could point to a video or maybe someone had already watched that video and just kind of the use of digital tools for client interaction in general.
So in my situation, not too much yet, but I totally could see that happening, especially if you're an individual practitioner who sometimes we send them to YouTube videos. Oh, here's one on how to clean their ears, and here's this, and here's that. But to do your own and then to say, hey, go to my Instagram account and there's videos on that, or I talk more about Cushing's disease or or things. I've mostly had it with friends up to this point where a friend says, I've told my friend, go watch your videos on vestibular disease because her dog has it. And so that's where I'm like, oh, good. That's what I want is for people to be able to go and to learn and maybe to walk into their vet clinic feeling, hey, I know a little bit about this because I saw that. And so I think for a practitioner could say, we've got this account, go watch it, talks a little bit more about some of the things we're doing, takes them in the back treatment area, and so they could see what we're doing back there and that it's just normal, it's not anything big and scary. It's just this is it's convenient because the bandage materials are here, blah, blah, blah. So, I think you definitely could use it for that. And I'm starting to see it a little, probably more with friends. But I just had a client the other day. I just told her I had this account because I haven't said a lot at work too much to my clients, but once in a while I'll be like, "Oh, I'm doing this Instagram thing," and then they'll watch it, and so it's kind of fun then to get their feedback, and they'll be like, "I learned so much every time I watch one of your videos." That's good because it does take a lot of time because I'm such a rookie at it to think, "Okay, I helped somebody. That was good."
Absolutely. Yeah, to go out there and probably helping other practitioners too to say, hey, there's actually this great video. You can watch it on Instagram. And, Dr. Wheeler explains everything about
Hmm.
it. So watch that and then call me back with questions. I love just approaching things in that way because for me as a learner, I was like the kid in vet school that I got yelled at for you have to be in class. And I think it's important to be in class. I bonded, with my classmates very much over being in class, but I'm not a good didactic learner.
Okay.
I need I need to absorb it in my own way and then I can go back and have somebody talk to me about it. But just to listen and absorb right in that moment, it doesn't always work for me. So the thought of digital tools of like, I can talk to you about this, but here's a video or, here's an article that you can read that's geared toward client education about this, and then let's talk about it. Because thinking of how it would impact me personally, I'm going, you can explain all this to me. I'm going to forget it by the time I walk out the door.
Totally, totally. So many people are like that. I'm like that. The other thing I do when you're talking about just how do you use technology to help you, with besides Instagram, is I have changed a lot over the years. I used to call everybody back about their blood work and stuff, and then I'd be talking to the husband, and then we've all had that, and then the wife calls back and wants it all. So I have started sending a lot of emails, and we have a lot of documents that we just paste, and so I've got like for routine blood work. I've got one that just kind of explains what we did and that it was all normal. I've got things that talk about hyperthyroid in cats and all the options and Cushing's and some of the more common things where I can send an email and say, I'm sending this. You guys can read it and talk about it, and then I will call you in a couple days. So then they've had a chance to absorb it and and reread it and have their spouse read it. And then it just speeds things up when you actually do talk and say, okay, what did you guys think? What did you decide? What's our best next step based on what I sent you? That is a helpful way too. Videos, I think, certainly have that ability too to say, hey, watch this. The problem I have found as I like to talk. And so in these Instagrams, you get 90 seconds.
Yep.
And so that is so hard. I'm like,
Yes.
I want to keep going. And now I think I've put out enough videos I can do 3 minutes. And so that's helpful. It's like, okay, I have a little more time. Because, I mean, you can't talk about, I'd love to talk about like seizures, but I can't do a seizure talk in 90 seconds. But for owners too, you could start to do short little ones until you're just starting out, and then eventually you could get longer. I think there is YouTube you can do longer, and there's other things. I just haven't explored those yet, but I think those are certainly good options for longer videos if people want to do that. But yeah, but that's a limitation. It's like you can't really explain Cushing's disease in 90 seconds either. So
That's a good point. That's a good point. Yeah, you can probably hit some highlights and then
exactly.
really just create more questions. But yeah, doing it in series or something like that to get
Hmm.
the information out there. Yeah, just to give clients something to review and also listening to what you said there. It also sounds like it could be a way to really empower staff members, to empower technicians. If they have a really good hold on say a certain disease process and you sent this beautiful email with all the information for the client to review, I think that could be another way to sort of increase efficiency in the clinic to say, hey, I'm going to go see this appointment. Can you call this client back? They already have all the information that I sent them, and, kind of see if they have any questions and go over that and be an empowering.
I've totally done that. I've just said
Yeah.
I've sent them the stuff, call and see if they know if they want to go ahead with the surgery, or if they, yeah, do they want to get the methimazole, or, what do they want to do? So that is so helpful. And we have great staff. I know it waxes and wanes in many clinics. Right now, we have great staff, and it's such a blessing to work with competent people who are so helpful that way. Our techs do so much. And I'll also be like, I mean, I know how to copy and paste records if a client says, oh, I need them, but it takes me forever. So I'm just like, put it on their work list and they do it for us. And they are same with texting after surgery. I was supposed to learn it. I'm just like, I'm taking the old lady card, and I'm just like, you guys,
Yeah.
I've got a lot of stuff I do. You guys text for me. Could you send a text and say everything's fine and blah blah blah. So
Well, absolutely. And I think, adding responsibility, especially when it comes to interpreting different medical things and being able to explain them and understand them better in a way that I'm not trying to speak for all technicians here because I know everyone's different, but I would imagine so many of us in this field, we're lifelong learners. We want to know more, we want to do more. So having the
totally.
opportunity to know more and do more and communicate that and take on that responsibility seems like just a really positive thing for everyone. It's freeing up doctor time to go see more patients. It's giving technicians an opportunity to learn more and dive deeper into disease processes and procedures and things like that. And then clients are getting the information through multiple channels. Maybe it's written, maybe it's video, or in these personalized emails, and then a phone call where they can interpret the information from multiple levels too and get a really good understanding of
Hmm.
this. So
Hmm. And our technicians do appreciate, I think, they yeah, they like using their knowledge and, like you said, learning and things. So yeah.
absolutely, absolutely, and getting those opportunities. I know we're coming up a little bit against time here, but I did want to ask you real quick a little bit more about your blog that you write. Is that more from like an experiential, this is vet med, or is that also from an educational perspective, or both?
So it actually is my dog who started writing the
I
blog,
love
and
that.
so my dog's Sophie, and so I was really good at it for a while, and I've really slipped off, but I want to restart that because that was a way to share information, and honestly, here again, it's like I can write, but then to put in pictures and do all this other stuff, it just like took forever. But I learned it, and so I can kind of do that, and so here again, I was trying to just write information to people about things and maybe some of it from a dog's perspective. I need to build that. I've got a lot of book ideas that I've thought about too, but it's so hard for me to sit still. And my mom used to always, mom, the great educator, would always just say, get your butt in the chair and write.
Oh,
And I'm like, I can't, but there's buckthorn to be pulled and there's, I have to go do this and then I got to throw the lot. It's hard for me
oh
to
yeah.
to sit and do all that. But the blog was, I started it with the thought, yes, a way to get information out there. And I would like to grow on that. Now my hours are kind of shifting back. So I have the time. I just need to make that. It took a long time to learn this Instagram stuff too. So I would add a lot of my focus there, but now I've kind of got it a little bit better. So I would like to get, always tell Sophie, you need to get going and write something today. So,
Come on, Sophie, get
yeah,
on
that's
it.
Sophie. So,
Well, we mentioned No Sweat Vet, but tell us, where can people find these amazing videos on Instagram, on Facebook, and your blog? Where can people hear more from you?
so No Sweat Vet is the my Instagram. On Sophie's Couch is my blog, and that's just a blog that it's if you look at it, you're gonna go, well, boy, the last year she's only written two things, but I'm going to get better. But it's got some pictures of Sophie, and we just talk about sometimes family things, sometimes dog things, sometimes from a dog viewpoint. So that's that.
I just pulled it up here and I can't wait to dive into this. There's some gold already. Oh, I'm so excited. Well, Dr. Wheeler, this has been so much fun. I'm so glad that we met, this past January, and to have you on the podcast to talk about this more. I hope more people will go and check out your videos and now your blog, because I'm definitely going to go check that out now.
Yeah.
And hear more from you, because I think you have so many good points to put out there for everybody. So thank you so much for agreeing to come on the podcast and talk to me. Any final thoughts that you want to leave our listeners with?
Well, first, just thank you so much for having me. I think the big thing is just do it. Because the first time I went to do my Instagram and I was so nervous, and my daughter-in-law came and said, we can delete them if they don't turn out. Or if you get 40, Instagram posts out there and you look back and you go, those are terrible, those first ones, we can delete them. So that was freeing for me. But I think you just do it. And if you just think it's a little daunting, but there's so much information there to teach you. So, and then also I think I would tell everyone to you have a voice, and your perspective is your perspective, and nobody else in the entire world has your exact perspective. And that is worth something. And so don't compare to all the other people, because there's always going to be people doing way better or way worse, but they're just don't compare. Just say if this is where I want what I want to do, and this is how I feel like I could grow myself, grow my client base, grow whatever, then just do it.
That's so empowering. I know I've certainly run up against that. I talk to, people who know way more than I do about
Oh,
all sorts of
all the
subjects
time.
all the time. And I really do get in my head on social media of like, well, what do I know about this? I'm just me sharing my perspective. This is what I think I know, but I talk to people who know tons more than I do about this. And that's so empowering to say, yeah, but nobody has my specific perspective on
Mhm.
this thing. And it's okay to share that. And oh, that's so empowering. Thank you so much.
Yeah, thank you for having me. It's been super fun.
All right, everybody, be sure to go check out the No Sweat Vet on social media. Dr. Wheeler's videos are great. I want to say a big thank you to everyone who tuned in. Dr. Wheeler, thank you so much for joining me. This was such a fun episode to record. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcasts. It'll help other veterinary professionals like you find this and other great content we try to put out there. You can also explore more episodes by checking out the Vetfolio website or listen wherever you get your podcasts. We're always eager to hear your thoughts and ideas for future episodes, so feel free to reach out to me at dvm@vetfolio.com. We can also connect on Facebook at Dr. Cassie DVM, or you can follow me on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.